Anaspaz, also known as hyoscyamine, is a medication used to treat a variety of stomach and intestinal problems such as cramps and irritable bowel syndrome. It can also be used to address bladder and bowel control issues, cramping pain caused by kidney stones and gallstones, and symptoms of Parkinson's disease. Additionally, Anaspaz can help decrease the side effects of certain medications and insecticides. This medication works by reducing acid production in the stomach, slowing down the natural movements of the gut, and relaxing muscles in many organs, including the stomach, intestines, bladder, kidney, and gallbladder. It also helps to decrease the amount of certain body fluids like saliva and sweat. Anaspaz falls into a class of drugs known as anticholinergics/antispasmodics. As for the daily dosage, it is important to follow the instructions provided by your doctor or pharmacist. The optimal timing for taking Anaspaz will depend on your specific condition and medical history, so it's best to consult with a healthcare professional for personalized guidance. To take Anaspaz, simply place the medication on your tongue and let it dissolve before swallowing. You can take it with or without water. The dosage of Anaspaz depends on your medical condition and how you respond to the treatment. It's important not to increase your dose or take it more often than prescribed without consulting your doctor. Adults and children 12 years and older should not take more than 1.5 mg in 24 hours, while children aged 2 to 12 years should not take more than 0.75 mg in 24 hours. If you have any questions about the dosage, be sure to ask your doctor or pharmacist. If you use antacids, it's important to know that they can lower the absorption of hyoscyamine. To avoid this, take antacids after meals and take hyoscyamine before meals, or take antacids at least 1 hour after taking hyoscyamine. It's also important to stay hydrated while taking Anaspaz, unless your doctor tells you otherwise. If your condition lasts or gets worse, be sure to inform your doctor. Some common side effects of Anaspaz may include dizziness, drowsiness, blurred vision, dry mouth, headache, trouble sleeping, constipation, flushing, dry skin, and decreased sweating. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects, such as mental or mood changes, fast or irregular heartbeat, difficulty urinating, decreased sexual ability, loss of coordination, trouble speaking, or vomiting. Seek medical help right away if you experience very serious side effects, including eye pain, swelling, redness, or vision changes. While a serious allergic reaction to this drug is rare, seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, and if you notice any other effects not listed above, it's important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Anaspaz, it's important to let your doctor or pharmacist know if you have any allergies to hyoscyamine, atropine, or any other substances. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so it's essential to talk to your pharmacist for more details. It's also important to discuss your medical history with your doctor before using Anaspaz, especially if you have conditions such as enlarged prostate, urinary blockage problems, certain stomach or intestinal problems, glaucoma, overactive thyroid, heart problems, high blood pressure, kidney disease, heartburn problems, certain nervous system problems, or myasthenia gravis. If you wear contact lenses, you may need to use wetting eye drops while taking Anaspaz, as it can cause dry eyes. Additionally, this medication may contain aspartame, so if you have phenylketonuria or any other condition that requires you to restrict your intake of aspartame, be sure to consult your doctor or pharmacist. Anaspaz may cause dizziness, drowsiness, or blurred vision, and alcohol or marijuana can intensify these effects. It's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. It's also recommended to limit alcoholic beverages and talk to your doctor if you are using marijuana. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to be cautious in hot weather, saunas, and during exercise or strenuous activity while taking Anaspaz, as this medication may increase the risk for heatstroke by decreasing sweating. Older adults may be more sensitive to the side effects of Anaspaz, and this drug may also pass into breast milk, so it's important to consult with your doctor before using Anaspaz during pregnancy or while breastfeeding. Now let's talk about the uses of Anaspaz. It is important to know that this medication may interact with other drugs, which can affect how they work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Anaspaz include certain antifungal drugs, bisphosphonate drugs, corticosteroids, digoxin, potassium tablets/capsules, and pramlintide. Additionally, it's important to let your doctor or pharmacist know if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Check the labels on all your medicines because they may contain ingredients that cause drowsiness, and ask your pharmacist about using those products safely. Anaspaz may also interfere with certain lab tests, so be sure to inform the lab personnel and all your doctors that you are using this medication. As always, it's important to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. If someone has taken too much Anaspaz and is experiencing serious symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents should contact their provincial poison control center. Symptoms of an Anaspaz overdose may include hot/dry skin, fever, unusual excitement, fast/irregular heartbeat, and seizures. Always seek immediate medical attention if you suspect an overdose. It's important not to share Anaspaz with others. Anaspaz is commonly used to manage digestive disorders and may be more effective when combined with lifestyle changes such as stress reduction programs, exercise, quitting smoking, and dietary changes. If you're considering making lifestyle changes to improve the effectiveness of Anaspaz, it's best to consult with your doctor or pharmacist for personalized advice. If you forget to take a dose of Anaspaz, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to store Anaspaz at room temperature, away from light and moisture. Make sure to keep it out of the bathroom, and always keep medications out of reach of children and pets. When it comes to disposing of Anaspaz, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.